What is anxiety? Anxiety is a natural response that human beings experience in response to stress, uncertainty, or danger. It is a common emotion that everyone experiences from time to time, but for some individuals, anxiety can become overwhelming and interfere with their daily life. Anxiety is often characterized by feelings of fear, worry, apprehension, and nervousness. It can manifest in various ways, including physical symptoms like increased heart rate, rapid breathing, and sweating, as well as psychological symptoms like restlessness, irritability, and difficulty concentrating. Anxiety disorders are the most common mental health conditions worldwide, affecting millions of people each year. They are also highly treatable, with various therapeutic and pharmacological interventions available to help manage symptoms and improve quality of life. To understand anxiety and its impact on individuals, it is necessary to examine its various forms, causes, symptoms, and treatments. There are various forms of anxiety disorders that individuals may experience, including generalized anxiety disorder, GAD is characterized by excessive and persistent worry about everyday events, often without any specific trigger. Individuals with GAD may experience physical symptoms like muscle tension, fatigue, and difficulty sleeping. Panic disorder is marked by sudden and intense feelings of fear or terror, often accompanied by physical symptoms like chest pain, sweating, and dizziness. Panic attacks can be triggered by a specific situation or occur without warning. Social anxiety disorder is characterized by fear and avoidance of social situations or performance situations due to the fear of being negatively evaluated by others. Individuals with social anxiety disorder may experience physical symptoms like sweating, blushing, and trembling. Specific phobia involves an intense fear or avoidance of a specific object or situation, such as heights, spiders, or enclosed spaces. The fear is often irrational and out of proportion to the actual danger posed by the object or situation. Obsessive-compulsive disorder, OCD is characterized by intrusive thoughts or obsessions that lead to compulsive behaviors or rituals. Individuals with OCD may feel compelled to perform certain actions or routines to alleviate their anxiety, such as hand-washing, counting, or checking. There is no single cause of anxiety disorders, and they can arise from a combination of genetic, environmental, and psychological factors. Some of the most common causes of anxiety disorders include genetics. Research has shown that certain genetic factors may contribute to the development of anxiety disorders. Individuals with a family history of anxiety or mood disorders may be more likely to experience anxiety themselves. Environmental factors, traumatic or stressful life events, such as abuse, neglect, or loss, can trigger anxiety disorders in some individuals. Environmental factors such as chronic stress, poverty, or living in a high-crime area can also contribute to anxiety. Neurochemistry, the balance of certain chemicals in the brain, such as serotonin and dopamine, can influence mood and anxiety. Imbalances in these neurotransmitters may contribute to the development of anxiety disorders. Personality traits. Individuals with certain personality traits, such as perfectionism, high sensitivity to stress, or a tendency to overthink, may be more prone to anxiety. The symptoms of anxiety can vary depending on the type and severity of the disorder. Some common symptoms of anxiety include physical symptoms. Physical symptoms of anxiety can include increased heart rate, rapid breathing, sweating, trembling, and muscle tension. Some individuals may also experience gastrointestinal problems or headaches. Psychological symptoms. Psychological symptoms of anxiety can include feelings of apprehension, worry, fear, and nervousness. Individuals with anxiety may also experience irritability, difficulty concentrating, and restlessness. Behavioral symptoms. Behavioral symptoms of anxiety can include avoidance of certain situations or activities, as well as compulsive behaviors or rituals intended to alleviate anxiety. Cognitive symptoms. Cognitive symptoms of anxiety can include persistent negative thoughts or worry, difficulty making decisions, and a tendency to catastrophize or overestimate the risk of negative outcomes. Anxiety disorders can be effectively treated with various therapeutic and pharmacological interventions. Some of the most common treatments for anxiety include cognitive behavioral therapy. CBT is a form of talk therapy that focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. CBT can be highly effective in reducing symptoms of anxiety and preventing relapse. Medication. Various medications, such as selective serotonin reuptake inhibitors, SSRIs, and benzodiazepines, can be used to manage symptoms of anxiety. These medications can help reduce the severity and frequency of anxiety symptoms, but they may also have side effects. Mindfulness-based interventions. Mindfulness-based interventions, such as meditation and yoga, can help individuals learn to manage their anxiety by cultivating present moment awareness and relaxation. Lifestyle changes. Certain lifestyle changes, such as regular exercise, healthy eating, and good sleep hygiene, can help reduce anxiety and improve overall well-being. In conclusion, anxiety is a common emotion that everyone experiences from time to time. However, for some individuals, anxiety can become overwhelming and interfere with their daily life. Anxiety disorders are highly treatable, and there are various therapeutic and pharmacological interventions available to help manage symptoms and improve quality of life. By understanding the forms, causes, symptoms, and treatments of anxiety, individuals can learn to manage their anxiety effectively and live a fulfilling life.